The spread of COVID is now hitting kids hard. Pediatricians in Kentucky are sounding the alarm. They say cases among children there are reaching critical levels, pushing local hospitals to the limit. Kentucky Children's Hospital says it's at full capacity with kids being treated for COVID and other respiratory infections. Many of the cases are children under 12 years old, not yet eligible to receive the COVID vaccine. At the same time, Kentucky is struggling to keep school doors open this year. Now, nearly 1/5 of the state's school districts have temporarily shut down because of COVID outbreaks. And of course, it's not just children battling COVID in Kentucky. The state's positivity rate overall jumped above 14% for the first time since the pandemic began. Nearly 2/3 of hospitals are facing critical staffing shortages. Now, FEMA has been brought in to help out. NBC News correspondent Cal Perry joins us from outside Kentucky Children's Hospital in Lexington with more. Cal, good morning. It is a pretty grim picture we just outlined. What have you observed there? What's the situation like on the ground?
Yeah, everything that you just said echoed by the governor, who said that this is a medical system, quote, on the brink. We have the National Guard, we have those FEMA strike teams. And as you said, more and more children seem to be getting sick. All of this, a very depressing way to introduce one of America's heroes, Dr. Scottie, who's been working on the front lines since the pandemic here. Give us an idea of what it's like right now, sort of inside the hospital, what doctors are dealing with.
Absolutely. So at Kentucky Children's Hospital, in the last month, since July the 29th, we've seen a 3 times increase in the amount of admissions for COVID for children here. As we talk about, we've seen rates that we didn't see before, and now kids are getting sicker. And we know that this is continuing to increase. And as we see it across the country, the concern is the silver lining of the COVID pandemic in the beginning was it really wasn't affecting children, but now it's affecting children, including children in the intensive care units, children in many ways missing out because they're quarantined. So there's so many ways this is affecting the children of Kentucky.
You and I have been talking this morning off camera. You've used the word preventable a number of times.
Absolutely. So a majority of the children that we're seeing admitted to our intensive care units and our children's hospital are children over the age of 12. Children that could have been vaccinated and not been in our hospital.
Before I let you go, we don't talk about this enough. Talk to me about the long-term mental health impacts that you're seeing in children.
Absolutely. Since the pandemic started, we've seen an increase in admissions for suicidal ideation, for self-injury. There's just so many things that we're seeing. As we talked about a little bit earlier this morning, what will be the story that'll be told about COVID-19 and the way that we protected the population of people who are later going to define the health of this great state? I think the mental health is something we don't even take account of. Not just children getting sick, but imagine that your primary caregiver, whether it be a grandparent, whether it be a parent sick with COVID, worse die. Right now, every 1 minute or a little bit more, someone dies of COVID. That is someone's parent. That may be someone's grandparent that's a primary caregiver. We don't really know. This is actually more fragile, I think, than anything we've ever seen in children.
You have young children. I know a number of the staff you work with have young children. What is the mental impact on them, seeing kids now starting to flow in sick like this?
I think it's hard not to think about, as a father, you think about your children, what can we do to prevent it? This is one of the reasons that we really want to be able to have a vaccine for children under the age of 12. This is something preventable. This is something to keep children out of the hospital. This is something to allow children to continue in the classroom, continue to get the education, and continue, we must invest in this. This is more important than anything in our lifetimes.
Dr. Day, thank you so much for what you do. Thank you for taking the time to talk to us this morning. I said yesterday, and I will repeat it again, you cannot disconnect the school system here from the medical system. They both have to do with each other. We'll see how Kentucky gets forward. Very low vaccination rates in some of these more rural counties. That's going to be important moving forward, guys.
All right, Cal, thanks to you and thanks to Dr. Day there in the Bluegrass State. Appreciate it.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.